We are now coming to the close of this fireside chat, but it is heartwarming to hear of the impact that FAH has made in the various spheres. And thank you, Nan, for using the bridge as a way of demonstrating the work that is being done. For me, what stood out is a bridge from an idea to an institution, a bridge from evidence to action, and a bridge from reality to the future. Thank you so much for that. As we close this segment on looking back, I would like to invite everyone to participate in helping us in our self-reflection. There is a Zoom poll that is going to pop up shortly on your screens. And the question is, if you have partnered or worked with FAH before, please describe your experience with us. It is important for us to continue to get this kind of feedback because as we grow, we want to learn and we definitely want to do better. And we want to continue doing those things that we are great at and try to improve on those things that we have not done so well on. So thank you so much for all your voices on the poll. Thank you. And now, ladies and gentlemen, the moment that we've been gearing ourselves for throughout this session, it is a great pleasure to welcome once more our CEO, Dr. Angela Kishaga, as she's going to be presenting to us the 5-year strategy that will guide and ground us for the next 5 years. Can I see some virtual hands as Angela comes to the stage? Thank you so much.
Thank you again, Sizwile, and thanks all for all who've been able to stay with us thus far. We can't, like I said before, we can't move forward without actually acknowledging where we've come from. And I'm excited to be sharing our next 5-year journey with everyone here. We have seen and heard how far we've come and how much impact that still remains to be achieved. Because I recognize that very new and potential partners on this call, and for the sake of refreshing all our understanding of what FAH is and does, I'm going to go quickly through who we are and the services we offer, and then talking about how our strategy continues to evolve. So, as you've heard, FAH is an Africa-based and Africa-focused health financing investment advisor on the next slide that facilitates relationships between governments, philanthropy funders, private sectors to advance primary and community health systems. Our true niche is working exclusively with governments to mobilize the financing that is required to make sure that community health systems are sustainably financed. When you hear Mr. Kiluku talking about being able to secure the budget lines, when you hear Yurida saying that she has a phone, she has a kit, she's been able to receive an increase in her stipend, that is as a result of the work that the government has done and partners in country, the government giving domestic budgets that then makes that possible. And of course, in-country partners supporting the government in that. We exist as FAH to directly influence $1 billion towards reducing the $4.4 billion annual funding gap for the community health financing on the continent. And our goal will be, as we continue to grow, how do we make sure that community health priorities are included in the health sector strategic plans, the global health security plans, and within UHC more broadly. We have and continue to punch above our weight, challenging status quo while taking a very learning stance, coming to the challenges with curiosity and passion as well. As you've heard, financing is a key bottleneck to the scale and sustainability of primary and community health systems. And so what does FAH do? Contrary to what you might be getting the implication of, we do not come necessarily with the financing. What we do is we support ministries of health, finance, and other line ministries, get the political prioritization in place, which we know is critical and fundamental to avail resources. We help cultivate champions across government. We help governments articulate their priorities in policies and costed strategies, which then we develop an investment case for and then use that to crowd in different types of stakeholders. As you've heard as well, and we'll talk a little bit more about the African Frontline first, we don't only help governments tap into existing financing solutions, we also co-create solutions that governments can get money at the order of magnitude of scale and at the time that they need through some of our services. You can see down there our outputs. I'll not go into a lot of detail, but for us, our outputs are the first step in helping to mobilize resources for the government. And we have and continue to secure budget lines, domestic resources, which catalyze other types of money, as Madeline had alluded to earlier. We support governments through an accompaniment model where we embed team members for multiple years within the ministries across different countries. And as you've heard, in Makweni, we've been there from 2020, Tharaka-Nithi, we came in 2021, and we continue to exist and work alongside the government. The goal of embedment is to facilitate knowledge and skills transfer. It helps our team fully understand and immerse themselves in the local context, but also helps us also learn from the governments, even as we share some of these skill sets with them. The insights we have gained from the first 5 years of existence are almost as important as the achievements that we've shared earlier on in this call. Even as we succeeded in securing domestic budget lines in country, it was very clear that the resources currently committed to community health as a whole were insufficient to close the $4.4 billion annual funding gap. Given that community health allocations come from the larger primary healthcare allocations, we have evolved our vision and expanded our strategy more upstream so that we can be supporting primary healthcare financing, which will then be able to support us influence more resources downstream towards community health systems. So as we go along in this new strategy, we will continue to support community health system strengthening through its financing, but we will also influence the primary healthcare financing space to enable us to meet our community health targets and goals. Of course, with this expansion, it will be rolled in a phased manner across the next 5 years, and we'll talk a little bit about that shortly. There are principles that FAH was built on, principles around, and we plan to strengthen these principles, especially principles on diverse partnerships, as you've heard, even as our name implies, the Financing Alliance for Health. Partnership is core in how we work and how we do what we do in countries, and even how we engage our government clients and communities. Systems change, we have and will always be a systems level player. We do not implement. Our role is purely strategic and technical advisory with governments to allow for others within the ecosystem to thrive. And we will always be working and focusing on scale and sustainability. We need to improve, and we will communicate our story better. Our goal is to become more comprehensive, consistent, and concise with who we are and describing what we do in the landscape. And as we've learned from the first 5 years, the resources that support community health systems go beyond ministries of health and finance. And our goal will be to engage these multi-sectoral actors and leverage their resources, be it time, expertise, and of course, financial resources to help sustain community health systems that we all leverage and make use of as well. And to all what we've been waiting for, what is our strategy in the next 5 years? Here in a page, we have summarized what is available in more detail later on. The FAH has 4 strategic pillars. As you had from Madeline, the first strategic pillars around the top-down money that we influence. The second one is about the bottom-up policies, the country-level work. The third one and the fourth one are really around the skills and the people that are going to be required for success. Our strategic pillars reinforce each other at a country, regional, and global level. Given that majority of the primary and community health financing in this landscape across Africa comes from regional and global flows as opposed to country-level flows, we do plan to transform how primary and community health is funded so that we can reduce the fragmentation and increase the effectiveness of the resources within the space. So our first strategic pillar really aims to increase the amount, the mix, the alignment of funding to reduce the overall funding gap. Our big bet under this strategic pillar is the Africa Frontline First Initiative. And you've heard that name over and over again, and you will hear a bit more about it even as I go along. We explore how to make sure we're bringing all the partners and resources together. We will also explore complementary financial mechanisms and approaches that will crowd in private sector to complement, of course, what we'll be doing in the Africa Frontline First. So our first strategic pillar will be focused on the Africa Frontline First and complementary financial approaches. Under this, the impact, the outcomes we want to do is and accomplish is mobilizing $400 million under the Africa Frontline First. Of course, phase one, and you had about this from Catherine at school and also from Nan, is that under the Africa Frontline First Catalytic Fund, we have already secured $100 million, which we'll make available to governments and their key partners to remove the bottlenecks that retard community health systems from going to scale. And then phase two, which will be where we'll have a scale-up approach, we will look to secure $300 million to help governments reach that within the strategic period. As we've had Africa Frontline First, what we call from the AFF, will run until 2030. And of course, within this strategy period, our goal is to be able to mobilize around $400 million under the overall Africa Frontline First initiative. For the complementary mechanisms, our goal is to try, we'll be focusing really on bringing about $20 million to complement what we'll be doing under the Africa Frontline First. So the first strategic pillar is really about the money, the top-down regional flows that come from many of the players in this space. The second strategic pillar, and our fireside chat participants and our friends and colleagues and clients, Mr. Kiluku and Yurida talked a lot about this, is really around the bottom-up policies that secure domestic budget lines. As we mentioned before, in the last strategy, we were able to mobilize around $12 million on budget, and we'll be looking to increase that in the next 5 years. And the goal is to have government ownership, co-contribution, and long-term financial sustainability. And we will achieve this by securing domestic budgets, not just for community health, but integrating community health into primary health care, global health security, and UHC priorities in countries. If there's something you've had on the call today, is that governments do work. Governments do have impact. Governments do co-finance. Governments do prioritize community health. And we need to continue working together with them to make sure that that is institutionalized much further. FAH is a demand-driven organization, and we will seek to expand to new countries that are really diverse. You will not see any country names here in our strategy because, as we said, we are demand-driven. We do receive requests. Of course, we have priority countries, but we work under the invitation of governments. And our goal will be to make sure we continue to be diverse geographically, language-wise, and also socioeconomic wise. Where feasible, because FAH and AFF do have similar priorities, we will try and overlap a number of the countries so that then we're able to really truly move and nudge the in-country landscape to a positive area. The third strategic pillar is making sure that we avail the necessary skills. And something that Madeline said, we have, and I also believe Nan talked about this as well, we do have a lot of knowledge and evidence and insights, and we have customized those in ways that we can share more broadly. And we'll look forward to, through our online and in-person content, upskill and share skills with policymakers and health leaders so that they can also advocate and secure funding in their context, whether or not they have direct FAH support. And in this pillar, our goal will be able to support the upskilling of about 3,000 new stakeholders in our new strategy. The fourth, and which is really a cross-cutting pillar, is around people and ecosystem strengthening. And this is an area we have been opportunistic in the first 5 years. Africa Frontline First, of course, is an example of that. But really, how do we strengthen the ecosystem? How do we become intentional about providing global goods? And in the next 5 years, our goal is to help bring more global goods to the ecosystem. We will develop a community health financing aim tool that will chart a sustainable financing pathway for multiple countries, depending on where they're starting from and going. We recognize, and Nan mentioned this as well, there seems to be a language mismatch between the health folks and the finance folks who actually have the money. And so how do we help support people understand how to articulate their case more strongly, and also be able to have impact in terms of securing domestic budget lines? Again, as we continue to evolve and expand our scope, our goal would be to implement this in a phased manner over the next few years. As we mentioned earlier, our big bet for the strategy is Africa Frontline First. We originated the idea, we provided seed financial investment through CHAP, and we have collaborated with multiple people on this call to bring this to life. This is a priority for the FAH in the next 5 years, and it will continue to be quite front and center in helping us contribute to narrowing the community health funding gap on the continent. We will provide a link on the chat box you can read all you want about AFF, but Africa Frontline First is really a collaborative initiative that is focused on transforming how community health systems are financed and how they're operationalized to be more effective on the continent. Our goal is to institutionalize and fully support 200,000 community health workers across 10 countries by 2030. It's going to be implemented in a phased manner. It will work on financing, getting the right decision makers to back it, and also, make sure that countries are actually sharing experiences and what they've learned, so that we can move together and move forward as a system. The founding partners of the Africa Frontline First are FAH, the Last Mile Health, Community Health Impact Coalition, Community Health Acceleration Partnership, under the championship of Her Excellency Ellen Johnson-Sirleaf. And we have continued to expand the partners to a large number of people and organizations under the AFF partners, majority of whom are SHIC members and also beyond. You can read so much more on the link provided around AFF, but this will continue to be a big bet for FAH in the next 5 years. I mentioned this earlier, and I'll keep saying it. Our people at FAH are our most valuable resources, and I'm so glad to continue hearing from them during this event and beyond. And our goal is to continue to grow our team, not just numbers-wise, but skill diversity-wise, to help us achieve what we are planning to in our new strategy. We will retain Nairobi as our global headquarters, even as we strengthen our US entity. And our goal will be to deepen and broaden our regional and global partnerships to be able to meet the demands of this expanded scope. Of course, with growth, if it's geographical growth, if it's team growth, if it's strategy growth, our budget for FAH will continue to grow. So the FAH budget as an institution, and also what we will contribute to supporting the Africa Frontline First Secretariat, will land about $5.5 to $7 million per year over the next 5 years. And that will be able to help us support the growth that we are seeing. On this last slide, on behalf of everyone represented on these pictures, our board, core team, our clients, governments and community health workers, the people we serve, we do look forward to continuing this journey with you. The full strategy documents and the one-pager will be available on our website, and there'll be links potentially dropped in the chat today. In closing, I just want to say thank you to everyone. Non nobis Domini, non nobis, sed Domini tuda gloria. Obrigado to everyone, and Yala Sizwile, take us to the next session.
Wow, thank you so much, Angela, for the presentation of our 2023 to our 2027 strategy. I am truly excited for what has been shared this afternoon, and there is truly nothing to add. The mandate has been set. We clearly have work to do. And of course, when the load is shared, then it will feel a bit lighter. That is why the presence of so many of our partners, colleagues, networks on this call today is very important to us. Thank you so much. There's a link on the chat box to our website where you can access the strategy and read it later in depth if you would like to. And I would encourage everybody to go to the link and really read the strategy and reach out to us via our various communication channels with any questions or any other comments even after this. Thank you so much. And last but not least, I would like to invite Ms. Joyce Chalo to please come and do the vote of thanks for us this afternoon. Thank you, Joyce.
Yeah, good morning, good afternoon, good evening, everyone. My name is Joyce Chalo. I'm the head of the country programs within Financing Alliance. And so this is the last session of this annual occasion of launching FAH strategy for 2023 to 2027, the next 5 phase, being a 5-year-old organization. And so I just wanted to really reach out to our dear guests and most valued partners. And on behalf of the board within Financing Alliance, and as well as the CEO and the fellow staff, I would like to actually extend our gratitude to the guests who have spared their precious time to grace the Financing Alliance for Health Strategy 2023 to 2027 launch and occasion with their presence. And with that, I would wish to particularly share our sincere thanks to the partners and funders, particularly the host governments present, again, looking at both national and sub-national level here in Kenya. I would also want to thank some of our partners in terms of funders, Skoll Foundation, Johnson & Johnson, Goldsmith Foundation, UBS, LGT Venture, just to name a few, for trusting FAH for the past 5 years and being the backbone as we bolster our work in community health financing in the region. Again, I want to look at and just share our warm thanks to the Financing Alliance for Health Board and the CEO, Dr. Angela Gishaga, for your vision and commitment to work and execute this strategy. The high standards you have set for the team, and it can be done attitude will really help the team excel and continue growing Financing Alliance to greater heights. As we know, behind every successful organization or projects lies the manifold attempts of our committed staff and colleagues. And so I'd like to take a moment just to acknowledge the immense contribution of the dedicated staff, both past staff and even the current staff. And again, just to go back, we have government's representation here. We have especially governments who help us serve the community. And of course, the success of Financing Alliance rests on the partnerships and collaboration with these governments. Our engagement and the impact that we ultimately have in communities, particularly for women and children, rely on these partnerships. And so thank you all so much. And we look forward to greater collaboration and partnerships. And finally, in the end, we have Eurydice, who has really talked of her work in the community. And so we cannot talk about impacting communities without health workers, without community health workers like Eurydice, and even the clients, the communities that we serve. And so I would really like to extend my wholehearted gratitude to our illustrious frontline health workers who always live up to our expectation and who are the pillars of strength in the communities. Ultimately, our work should actually bring the change in terms of health to the communities we serve. So With this, I would just want to appreciate all of you just for taking this time to join us. And thank you all for making this launch of the Financing Alliance for Health Strategy an enormous success. We look forward to you joining us in steering this ship in the next 5 years. And so thank you again. So over to you, Sizwile, and thank you so much.
Thank you so much, Joyce, and thank you so much, everyone, for joining. Can I just request the tech team to remove the spotlight so that all the Financing Alliance for Health team members have their videos on and the guests can see the lovely team that is behind this great work. So I would invite as many team members as possible to have their videos on. But otherwise, it's been a great session. Thank you so much all for joining us. Have a great day further if your day is just starting, and have a great evening if your day is coming to an end. Thank you so much all, and goodbye.